You are now live.
All right. Good afternoon, everyone. Welcome to today's Patient, Family, and Partnership Council. I am the chief nurse here at the medical group, and we have a few things to share. One is that we're trying to utilize more of our technology to reach our beneficiaries. So you will see there are different options: Facebook Live, we've utilized Teams, and we're also having this recorded on YouTube. We recognize these are 3 different platforms, and if you have questions while we are briefing today, please make sure that you type those in, and we'll be monitoring those and we'll include them in the presentation today. If there is something that you don't want to share online, I believe my contact information has been sent out. I would like to offer that at the end of the presentation, so you can reach out to me and ask questions if you don't feel like you want to discuss it in front of a big group of people. First things is oh, perfect. So our PFPC mission and vision statement. So our vision, of course, is to provide premier health care to all of our customers. It's about the patient experience. And we encourage that our beneficiaries are active participants here at the Med Group so that we can provide that patient-centered care. Our mission is, of course, enhancing that quality and safety of patient care, and then the actual customer experience. And so I want everyone to know that I have only been here about 1.5 years, but myself and then those that were running this PFPC before, we have taken a lot of feedback to improve policies, procedures, programs, and practices. So the information that we gather today, the feedback we get, is very important so that we can improve the patient care delivery.
Is the YouTube something video or just audio?
It should be video.
No.
It might show up
So
later.
I need to send you that new link.
All right. So, and while we're discussing some of the information today, if there are questions that the Healthcare Insurance Portability and Accountability Act, breaching any kind of protected health information, we would ask that anyone that is listening and might be putting questions in to keep that in mind. We want to protect patients, safeguard the privacy and security of their health information. So please keep that in mind when you're asking questions. For those that are here in person, we will turn off all of the technology that we're recording that can be shared publicly, so that we have an opportunity to maybe ask some of those questions in a smaller environment. And our effort is to have confidentiality, so this is the ethical principle or legal right that a healthcare professional will hold secret all information relating to a patient unless the patient gives consent permitting disclosure. Today, this is our agenda. We're going to talk about referrals, claims, our family day schedule, some of the portal online booking options, some of the clinic forecasts, pharmacy services, patient advocacy, avenues to care, and of course any feedbacks and questions. All right, we'll start with referrals.
Good afternoon, everybody. I'm Lieutenant Colonel Osama. I am the Tracker Operations and Patient Administration Flight Commander. Our referral process hasn't changed, so what will happen is once you see your provider and receive a referral to another subspecialty, it'll go to our TriRest referral management clinic. They'll then help that process to help get it approved and authorized through TRICARE. It can take up to a week, so please be patient. What you can do as a patient is have your portal set up, because through the portal, you're able to monitor that progress and status of the referral. If you have any questions about setting it up, we do have clerks sitting at the front desk on the second floor, and they're more than happy to help you. If you receive the authorization back from TRICARE and maybe have a different provider that you would like to use in the same subspecialty, you as the patient can go into the portal and change that provider. It will require another approval authorization, so that may take a few more days. I would say that those are the most commonly asked questions or issues that we have with referrals. But if you have any others, you can please put it in the chat or come up to the second floor. Once you've gone and seen the provider,
Good afternoon, everyone. All right, having some technical difficulties, but we're going to press. All right, so this slide kind of captures what capabilities we offer, specifically as it pertains to family days. Most of our patients are tracking that on family days designated by Global Strike. We do offer acute appointments from 0700 to 1100. The next family day is actually scheduled for this Friday, the 28th November. However, there will not be any acute appointments on that particular day. Acute appointments, what constitutes an acute appointment? Ideally, an injury or an illness that requires you to be seen within 24 hours. PRAP and flyers, they are to actually show up for walk-in services. So you have the patient portal, you have the appointment line, those are avenues to book appointments. However, when it pertains to the patient portal, that is not applicable to any flyers or to PRAP patients, so just keep that in mind. The phone number to the appointment line is 505-846-3200. And any ancillary services that are available when we are open for acute hours include lab, walk-in services, radiology, pharmacy, and referral management. All right, here are our upcoming closure dates. Just to reiterate, this Friday, VERT's only for PRAP patients. All other clinics in the Med group will be closed. Okay. Here, a lot of information on the slide. Once again, the appointment line, 846-3200. Just wanting to inform all of our patients across the board to be very careful as you're going into the patient portal to book appointments. Make sure that you're booking with appropriate providers. We have now denoted provider names within the portal to align with the clinic that they're associated with to make it easier for our patients to book their own appointments. There are virtual appointments now available in our warfighter clinic that can be booked. Patient portal, face-to-face appointments. That is actually the next project that we're working on to allow our patients to book not acute appointments specifically, but for routine appointments with their providers. That's all I have. Over to you, Joseph.
All right, so this is new. We wanted to share this new dermatology telehealth program that is available for active duty. What we just started last month is that we've recognized that it can be difficult to get a dermatology appointment in the local area. So we've worked with Lackland Air Force Base and their dermatology team to try to find a way to provide that level of care to our active duty staff. Right now, the process is the primary care manager will send a referral to the 377 Telederm clinic. The staff at that clinic will contact the patient to schedule an appointment. Then the 377 Telederm clinic team will perform an intake at the appointment with the patient. That will include photos, a very comprehensive history, a questionnaire that has been developed by the Lackland team, and so that they can get all of the information they need to assess this patient and provide the treatment plan. Once the Lackland dermatology team receives that information, they will provide that treatment plan to the patient care manager, the PCM. And the PCM will contact the patient to let them know what the dermatologist would like them to try and do. And that is in an effort to try to make sure we get care for conditions such as some rashes like psoriasis or seborrheic dermatitis. Maybe there's a concerning lesion that would like to be evaluated for biopsy or for even more specialty care. There's a wide range of conditions that dermatology at Lackland can see virtually. And so this does provide a lot of opportunities for to connect patients to care sooner. We already have I talked to one of our staff in the Warrior Medicine Clinic this morning, and there was over 200 referrals for dermatology. They combed through those dermatology referrals, and they have been prioritizing who meets the criteria for this type of clinic, and they've been contacting the patients to schedule them. So this might be something some of you are already experiencing. You're getting calls and being scheduled to see the provider or the team here, and then be assessed by the provider in Lackland, and so in San Antonio. So great thing that we've been able to do here at the Med Group. Any questions at all? All right. And then Captain Smith, I'll go over this as well. So for active duty and Warrior Medicine Clinic, we are offering a virtual booking option through the Genesis patient portal. Unfortunately, this is not available for our flyers or any on PRAP status. But some of the ways you can use this virtual option and just go into your patient portal and you can find a virtual appointment that's open and book that. And say you have, you would like to modify or follow up on a medication that you were prescribed, or maybe you want to review some lab or radiology results. Perhaps you were seen off base at urgent care and emergency room, and you would like to follow up with your provider on the plan of care. Maybe you want to just speak with the primary care manager about something that's going on, and you want to see if you need to be coming in for a face-to-face appointment, or if this can be taken care of virtually. If you are coming back from deployment, you can also schedule that virtual appointment for your DRHAs, excuse me. If you have any conditions that you have had for some time and you just need to follow up with your provider, say it's for allergies, or maybe it's your a rhino or sleep apnea, you can make that appointment with your PCM to discuss those rather than coming in. Profile renewals, and then any kind of referrals that don't require a face-to-face visit. And so often our teams are scrubbing to make sure that they're appropriate virtuals, and even if the virtual is able to capture some of the things at the appointment, they'll schedule a follow-up in person if that's needed. Any questions about this option? All right, let me see.
Good afternoon, everyone. I'm Megan Rivera, Pharmacy Flight Commander, and today I'm just going to go over 2 updates for our services since our last meeting. So, as you may know, all prescriptions now, starting October 1st, needs to be activated. The idea is to standardize the process no matter where you get seen, if it's off base, on base. all patients can follow the same process and possibly avoid less confusion. Also, when we use this, we communicate better with the patient. If something is out of stock or requires a prior authorization, they don't need to be here to get that message. And hopefully we can save you a trip before you get here. So the intent is to standardize the process and we can communicate better with all our patients. Again, this is our virtual check-in process, not available 24/7, so just keep that in mind, and it's only available during hours. The second update is the prescription drop-off at the BX. Back in 2022-2023, due to manning concerns, they consolidated all services at the BX pharmacy. Over a year ago, we decided to open the facility downstairs to kind of split our workload a little bit better. The drop-off box was installed back there for patients that were not willing to wait longer wait times. Back then it was over 2 hours, so they can come in, fill out a paper, and just put the prescription in there so we can process it later on. However, with the new process, we don't see that being utilized. We can probably get 1 or 2 prescriptions a week. So we want to, just standardize the process, make sure that if you're at the BX, at least you have the information on how to activate before you come here. If you have a paper prescription, of course, we have window 4 for you to drop off. Again, it shouldn't take more than 2 hours to just drop that off and check in. And that's all I have. Any questions?
Hello, I'm Sergeant Laredo, so I'm one of the patient advocates here at the group. So of course we talk a lot about feedback, so these are a couple of ways that we receive our feedback for the med group, whether it's for pharmacy services, care on your team, or anything that you've seen on base even. So we have our ICE customer service evaluation. Again, that can be clicked, an input, you can put your information, you can put a callback number if you'd like, or you can submit it completely anonymous. The next up is we have Joe's. So Joe's is randomized. We started moving forward with Joe's texting systems, but they also still love to do the old-fashioned mail order. So if you ever get those surveys, please fill it out because we do look at all of them, whether it's a mail order in one or a texting one or an online one. It helps us know what's going right, what's going wrong, and how we can make it better here for you, your family, and your care. So feedback is always appreciated. We're going to go over just a couple of changes. I know with the patient advocate program as a whole for our med group has changed over a little bit. So again, feedback is going to be important when it comes to these programs, so that way we know what's going to be working for patients and what's going to be working for you and your family. So we do have 2 squadron representatives for our patient advocate program. I know we're used to maybe just having one person that we go to, and then I'm going to go through all of our embedded and specific clinic advocates. So I'm Sergeant Laredo. I am the HCOS squadron representative, so I can help connect you with anyone in the med group, but specifically for TRICARE operations, pharmacy, family health, laboratory, women's health, and peds. I can connect you to any of them whenever you need, but if you have any kind of call, you can either give us a call on our nifty little phones, or we have our patient advocate org box. It does get checked every day, and we do reply to patients. We have a timeline set up just so that way we can make sure that we're getting to everybody and we're answering all of the questions in a timely manner. Again, the phones are only during duty hours, so please understand if you do leave a message on any of the phone lines, or again, the org box, if it's not during duty hours, that may extend the wait time a little bit. Our OMS advocate, we do not have a picture for him, but next time I will have a picture for Sergeant Miners. He is just taking over as well, so again, he has his own cell phone. He can connect you with the Warrior Clinic, basically all your active duty flights, physical therapy, flight med, PRAP clinic, public health, dental, mental health. But again, if you contact him, he can connect you to anywhere in the med group. So we're going to go through just a couple of our clinic patient advocates. Again, it's going to be a lot of numbers. I'm really glad this is being recorded because that'd be really hard to remember all of the things. So these are just some of our POCs when it comes to our clinic-specific advocates. So just remember, if you are reaching out to your clinic-specific advocates for something, you can always reach out to the squadron reps, but these are the people that we're probably going to direct you to at first. If for some reason we need to go somewhere else, or you have other questions that maybe they can't help you with, then we can step in and help you with it. So just some more numbers. And then here's our last little bit. And more to come on Patient Advocate Program.
All right, so Avenues to Care, we're constantly updating this. It's a one-stop shop to kind of look at, okay, what is it that I need the med group for? If you're new to Kirtland, we have some information to contact TRICARE to update your location, update DEERS, and then if you need to make an appointment, we have the appointment line number here. And then if you just need an appointment, calling the appointment line. We've also talked about some other options to make appointments, but you can always find the appointment line and will direct you to the right avenue for your appointment that you need. If you want to create a message to send to your PCM team, you can do this through the patient portal. I would ask, it's really important that when you go into the patient portal to book any appointments, especially if it's a virtual appointment, that your profile is updated to reflect the most current phone number. And when you book that virtual appointment, if your phone number that is in your profile is not the best way to reach you, please include that so that the team can reach you and make sure that you get that appointment, the contact with the provider like you expected. If you need after-hours care, the nurse advice line, we have the nurse advice line all day, 24/7. And so the nurse advice line during duty hours, we'll try to book into our clinics here when we have open appointments. If you need to see the urgent care or the ER for active duty, you need a referral to go and get care if it's not an emergency. Say it's for urgent care. And the nurse advice line can help you with that. And they'll direct you to the best urgent cares that are in your area. If you don't need an urgent care or an appointment, they can also give you they can triage you and kind of give you some home-based care and let you know when it's the appropriate time to call back to make an appointment with your PCM. If you need well-being support, Military One Source, MFLAC, virtual mental health care options, and then calling the appointment line to reach out to your PCM. We try to update as many options as we can because we recognize that not everyone wants to go to their PCM first. And so there are a lot of options out there for all of us. If you've just had a baby, you can call the appointment line so that we can make sure that you get that appointment once you've been discharged from the hospital. We don't have babies delivered here because we're a clinic, and we recognize that babies need to get seen with their pediatrician within days of their delivery, and we want to make sure that the babies are registered so that they can receive care here. There is a blanket of time where you can receive care anywhere. TRICARE will approve it, but we want to make sure that that process is started early so there are no delays if you still need care after that time period has passed. I believe it's 30 days. Does anybody know how many days it is? Okay. If you need pharmacy help, we had Major Rivera talk about how to do refills and renewals. And if you need to send a message on the patient portal, you can to Kirtland Pharmacy. And then you can also do the text and line option, which I love. I utilize all the time. So if I wanted a medication to get filled, I'm not going to fill it and sit and wait until it's ready for pickup. I can make sure that I can manage my time a little bit so that I can come when it's ready. So I love that option for myself. Immunizations help. So you can always call immunizations and they will, they'll either answer the phone, or if you listen to the voicemail, they'll go through all the options for any questions you may have. But you schedule appointments through a third-party booking, and we have advertised that with a lot of areas, and that's really helped the staff know like what you're coming in for, so they can give you the best care when you come in for your immunizations appointment. Labs, walk-ins are from 7:30 to 10:30. Right now they are not doing outside lab orders. And then they request that you make appointments from 10:30 to 3:45, and it's using the same booking party that we are for immunizations. And then if you need fasting labs, just remember you need to have no food or drink for 8 to 10 hours before you get that medication or get that lab drawn. If you have questions or concerns, like Tech Sergeant Loreto said, please give us the feedback. This is one of our avenues of getting some feedback and providing information to you. We talk about the comments that we receive through ICE, the JOES surveys. We really look at that feedback, good and bad, to try to make processes better here at the Med Group. So your feedback is vital for us to make this organization better for you. And of course, follow us on Facebook. I see that a few of you are online. If you have questions, let us know what questions you have and we'll answer them while we're here. We've got our experts in the room. And then the Air Force Connect app, I know we're working on updating that so that it will be accurate and the information we go over in this meeting is there for you to utilize at any point in time. Our next meeting is going to be in February, and I know that we had a little bit of technical difficulties at the beginning, but just to kind of reintroduce myself, I'm the chief nurse and I'm the PFPC chair. And a lot of the MTFs across the Air Force, the Navy, the Army, we all have PFPCs. So this is something that everyone does. And it looks different wherever you are. But we can't do it alone. And a lot of MTFs we would like to have a council. And in order to have a council, it's not only just the people that work here at the Med Group being a part of that council, but it is also maybe active duty members that are assigned to the Med Group as patients or their beneficiaries. And they meet with me and they make sure that whatever issues or concerns they're hearing about, I can make sure that this meeting addresses those concerns. I try really hard to monitor Facebook. I try really hard to look at our feedback we get through ICE and JOES, but the more feedback we can get in participation in PFPC, it can make the patient experience better for all of you. And so I just ask that you can email me, and I know my information has been pushed out. Certainly, I want to be available. Any of us here at the Med Group want to be available. I know I've commented on Facebook and on YouTube and on Teams. This is the last slide for the meeting. Can someone tell me if we've had any questions, comments, or concerns that have come up so we can address those?
There's no questions on Facebook.
No questions on Facebook?
Not on YouTube.
Okay, all right. Nobody else has any questions? Okay, so for those that have attended in person, we're going to turn off the video component and then just see if we have any questions from those here in the room. Thank you all for attending today, and for those that watched this after we recorded it, please don't hesitate to reach out and let us know what you need. All right, thank you. We often do this, turn in all of it.
Is there a different YouTube link? Because the one I went to never worked.
Yes, sir.
Do you have any questions while we're
Posted
off?
on to
You do.
I just sent you a link to Captain.
They are very short staffed.
Where is the
It's